Good afternoon, everyone. I'm Richa Parikh. I'm also one of the newer faculty members at Emory-Winship. I started last year. I think this is meant to be like a breakout session, so if you're interested and have questions in racial disparities and outcomes of myeloma, I think Dr. Nuka is heading that session in the room next door, and I'll be talking about nutrition and wellness in multiple myeloma. All right. So we've heard a lot this morning about the phenomenal advances that have been made in the therapeutic strategies in multiple myeloma, and we've come a long, long way from back in the 90s. And we have all of you people and all of the researchers to contribute to that success that has been made. But unfortunately, despite all of these advances, multiple myeloma continues to remain incurable. And so I think we ought to put in more effort and strategies to prevent the occurrence of multiple myeloma. And as Dr. Hoffmeister talked to you all earlier this morning about the precursor conditions like MGUS or smoldering multiple myeloma, this provides an interesting opportunity for us to do something to prevent that progression into multiple myeloma. Not all cancers have this kind of a precursor stage where you know that you have this condition that could go over into a full-blown cancer, and not all cancers have that kind of ability where we have that time frame where we can intervene, change something that we're doing in our lifestyle, and prevent the occurrence of that cancer. So multiple myeloma is unique in that way, that we do have identified precursor stages. And although little is known about the etiology of myeloma, we do have some data to suggest that metabolic risk factors like obesity, diabetes, poor nutrition, and changes in your gut microbiome, which are all modifiable, by the way, have been linked to the pathogenesis of multiple myeloma. At least 18% of all cancers in the US are related to excess body weight, physical inactivity, alcohol consumption, and poor nutrition. And currently, due to the lack of high-level evidence supporting survival benefit, currently for smoldering myeloma and MGUS, observation until progression to multiple myeloma is the standard of care. But that doesn't mean that all of you people who have these precursor conditions are not anxious about wanting to do something to change that risk. And here we, as physicians, often tell you that you just gotta wait, and we just wait and watch. And if this goes over into myeloma, then we start you on treatment. But many of you are anxious and want to do something about this and change this possibility of progression into multiple myeloma. And that too with low impact or low risk interventions. And so many of you in my practice that I've seen always have this question, can I do something at my end, doc, to change this risk? Can I eat better? What should I eat? What should I not eat? What can I do at my end that would make me have a lower risk of converting into multiple myeloma? So Jenny mentioned Dr. Urvi Shah, who's at Memorial Sloan Kettering. So she's one of my mentors. I've worked very closely with her. And we published an article a few years back where we looked at, comprehensively looked at the impact of obesity on the pathogenesis and outcomes of multiple myeloma. So this table right here actually summarizes some of the, I've picked a few large studies that looked at the impact of obesity, or a BMI, body mass index, which is commonly used to diagnose and risk stratify obesity, on the risk of development of MGUS and the risk of transformation of MGUS to multiple myeloma. And what we found was that overweight and obese individuals were at a greater risk of developing MGUS, and those with MGUS were almost twice as likely to progress to multiple myeloma. So the HR, or the odds ratio, or the hazards ratio, the higher that number from 1, the more increase the risk of developing myeloma. So as you can see, patients that were obese, which basically is defined by a BMI of greater than 30, they had a higher risk of development of MGUS and higher risk of progression of MGUS to multiple myeloma. And in this table, we actually also looked at the impact of obesity on myeloma risk and mortality. So meaning if you have been diagnosed with multiple myeloma, what are the chances that you would have a bad outcome if you're obese? And the findings in these studies, again, I've only picked like a couple of the important or larger studies, and that showed basically that the influence of BMI is often disease stage dependent. So in normal individuals without any kind of conditions, having an elevated BMI or being obese is associated with an increased risk of development of multiple myeloma, and also increased risk of having a bad outcome from multiple myeloma. But we found that at the time of diagnosis, at the time of stem cell transplant or relapse, excess BMI actually did not impact the survival. And I think what we think that might be due to is that it's just implying that patients with higher BMI have not had disease-related weight loss. So when your disease is too out of control, you might have like a decreased appetite, you may have a lot of weight loss. And so thinner patients or patients who have had a lot of weight loss, they don't do as well when they are going through induction therapy or transplant. And that's basically what is reflected in these studies, that if you have a higher BMI at baseline when you're normal before you had the cancer, actually increases your risk of developing cancer. But once you have myeloma, actually preventing too much weight loss might be healthier. And obesity, of course, is very interesting because it can be modified. This is something that we know has been shown to impact the risk of development of myeloma, and this is something you have control over and you can modify. And so that's why we've kind of delved into this in detail. And these are various mechanisms by which obesity is postulated to influence myeloma pathogenesis. So obesity is associated with an increased bone marrow and visceral adipose tissue, which is fatty tissue, and is associated with increased levels of leptin, inflammatory cytokines like IL-6, TNF-alpha, increased insulin and IGF, which is insulin-like growth factor levels, and decreased levels of adiponectin and resistin. And all of these have been associated with myeloma pathogenesis, interestingly. And we do need larger studies to further characterize the various molecular mechanisms by which obesity is influencing the exact pathogenesis of myeloma. And potentially, if we find the exact link, that opens up a target for treatment as well. So this figure here shows that based on data, multiple myeloma actually has been classified as one amongst the 13 cancers that are linked to obesity. So obesity is a risk factor, proven risk factor for 13 different cancers that we know of as of now. And now moving on to diabetes. Diabetes affects approximately 9% of the people worldwide. It's about like 400 million people worldwide, so very common. And with most of the patients having type 2 diabetes, like 90% of the cases are type 2, and there is a small number that are type 1. And there is a clear link between type 2 diabetes and overall cancer risk. Now, this link is not very clear, especially for multiple myeloma, but we are kind of studying that in a lot more detail now. The prevalence of diabetes in a retrospective study with about 5,000 myeloma patients showed that about 15% of myeloma patients have diabetes mellitus. And this is where it gets complicated, because diabetes affects a lot of the same organs like nerves, kidneys, eyes, and your heart and blood vessels, and myeloma by itself, and the treatments that we use in myeloma, like many of you may have gotten bortezomib or Velcade, causes neuropathy and affects nerves. And dexamethasone, which is part of all of our chemotherapy regimens, unfortunately raises your blood sugar and makes your diabetes out of control. So that's where things get complicated for patients that have both diabetes and myeloma. And so we looked at, Dr. Dr. Shah and I, we did another study where we actually looked at all of the different studies that were assessing diabetes as a risk factor for multiple myeloma. And this is one of the studies which was conducted in Israel, had about 400,000 patients with incident diabetes. And the study showed that there was an increased risk of overall cancer, including multiple myeloma, following a diabetes diagnosis. The highest risk was within 1 year after diabetes diagnosis, and then the risk gradually decreased, but still persisted up to almost 11 years. And this table also shortlists studies that looked at outcomes. So the first table was looking at the incidence of multiple myeloma in diabetic patients. And this study is looking at, once you've been diagnosed with myeloma, what are your outcomes, and are those outcomes better or worse if you have also a concomitant diagnosis of diabetes? And both of these studies basically showed that there is a higher risk of hematologic malignancies, particularly multiple myeloma, in individuals with diabetes. And the second study basically looked at the impact of diabetes on outcomes with myeloma patients, and of course, that the outcomes were kind of worse in patients that had diabetes. So thus, this kind of explains why good control of your diabetes and making sure your blood sugars are within range while being on treatment, or if you've not developed myeloma, it's just in general very important to have good control of your sugar. And this is the various mechanisms by which diabetes affects myeloma pathogenesis, mainly through insulin-like growth factor levels, causing high sugars or hyperglycemia, and raising the amount of inflammatory cytokines in your body. And now moving on to diet. So Dr. Shah's team actually did an online survey, probably through HealthTree, I'm not sure, but we basically did a survey of 421 patients with plasma cell disorders, and 82% of the patients had questions about their diet after their diagnosis. 57% patients actually reported that their dietary questions were not answered by their oncologist, which is very sad. Among those who received dietary guidance from their oncologist, 94% attempted to follow it, which just goes to say that if it comes from your doctor, you're a lot more likely to listen to that advice and follow it. And this basically shows, the survey basically lays the groundwork for the fact that there is keen patient interest, but there is limited data on diet and its risk for multiple myeloma, and we need to have more studies that are looking at this particular topic. So here are some studies that have been done. So the EPIC Oxford cohort and Oxford vegetarian study that looked at 60,000 British participants actually showed that vegetarians and vegans had a 77% lower relative risk to develop myeloma than meat eaters. The Nurses' Health Study and Health Professionals Follow-Up Study with like 116,000 patients showed that a particular dietary pattern called empiric dietary inflammatory pattern, or EDIP, which consists of a lot of inflammatory or high glycemic load diets, they had a 16% increased risk of multiple myeloma in women. And we personally did a study in the NIH AARP Diet and Health Study cohort, and we had about 500,000 people, normal people, who completed a food frequency questionnaire back in 1990s, and then they were followed until December 2011, so for about 15 years. And what we identified is that patients that followed a healthful plant-based dietary index, which is incorporating more of plant-based proteins and plant-based diets, they had a lower risk for multiple myeloma. So this study we've published, it's available online. You could look it up, and there is a concise table that actually has, based on scientific data, dietary guidelines for the consumption of fruits, vegetables, whole grains, fish, and like how many cups per week is good, how many cups per week is not good. So kind of spelled out for you, because I know many of you have these questions about what to eat, what not to eat. In general, cruciferous vegetables, so like cauliflower, broccoli, cabbage, citrus fruits like oranges, tangerines, whole grains, and seafood were all associated with a reduced myeloma risk, whereas high consumption of red meat and dairy products was actually associated with a slightly increased risk for multiple myeloma. And this same study, actually, we also compiled the evidence for different types of dietary supplements. So curcumin, vitamin D, vitamin C, omega-3 fatty acids, alcohol, smoking. So all of these questions that you have commonly and that probably are not adequately addressed, we've summarized all of that evidence in this study. It's available for you to view online. And these are some of the mechanisms by which we think diet has an effect on the gut microbiome. So the gut microbiome is the normal composition of the intestines with normal healthy bacteria or good bacteria. And it shows basically that when you eat all of these things like cruciferous vegetables, fruits, whole grains, seafood, beans, and legumes, they have a favorable impact on your gut microbiome. So they basically lead to increase in the percentage or proportion of the healthy bacteria and lower the number of bad bacteria, if you would, in your gut microbiome. And that one of those category of bacteria that is really beneficial is the butyrate producers, is what we've figured out by doing all of these studies. And incorporating this kind of a diet actually increases the percentage of butyrate producers, which has a favorable impact on your gut microbiome. So to look at this further, because we had all of this data from prior studies, Dr. Shah is actually looking prospectively. So most of these studies that I talked about, they were retrospective, meaning going back in time and looking at all the patients and seeing how they did. But this is a Nutrivention is a prospective study which enrolls patients with MGUS and smoldering myeloma, so precursor stages, and that are obese, that have a BMI greater than or equal to 25. And it looks as at a dietary intervention with a high fiber plant-based diet. These diet are like the high fiber plant-based diet is incorporated into the study with the help of a plant-based food company. And patients that sign up for the study, they actually get frozen meals which are rich in a lot of like high fiber vegetables and plant-based fats and low glycemic index and minimal processing, so incorporating a lot of whole grains. So the food packages are delivered to you for like 12 weeks, and there's also a dietitian that works with you and kind of helps you modify your diet. And this study went on for about 1 year, and they looked at it prospectively to see if any of these dietary interventions actually changed or altered your risk of progressing from MGUS or smoldering myeloma into multiple myeloma. And here we presented the results of the Nutrivention study at ASH last year. And what it basically showed that the intervention was feasible. There was good adherence to the diet, and it did lead to weight loss and improved the quality of life. So 23 patients were enrolled on this study. And the median age was 62 with a range of 40 to 79, which tells us that even patients in their 70s were interested in changing their dietary habits. So it's never too late to start. And they were split equally between males and females, different types of races, and basically evenly distributed across different BMIs as well. And the blue bar here in the first graph actually looks at like the baseline compliance to a high fiber plant-based diet, and it's very low. As you can see, it's way down here. And then after this intervention, it was about like 20%. And after the intervention, you see that at week 12, 24, and 52, the patients reported a higher adherence to a high fiber plant-based diet. And this actually was sustained even after the end of the study, because we are incorporating slow changes in your diet and lifestyle with pairing you up with a nutritionist who kind of helps you make those small changes, incorporate those small changes in your lifestyle so that it's more sustainable and it's not just a 1-year thing where you do the study and you lose weight and you get better and then you go back to your old habits of eating. So these studies were the study had very encouraging results. And most of the patients actually reported improved outcomes or improved symptoms. And all of the patients reported that the intervention was easy to follow. And some of them, 4 patients were even able to stop some of the medications that they were on, say for diabetes or for weight loss, because they were able to achieve their sugar was under control. They were able to achieve weight loss just with a diet. And this figure here shows basically a favorable impact on the gut microbiome and the insulin levels and the total inflammatory C-reactive protein, or CRP, is an inflammatory marker. And you can see that all of those inflammatory markers went down after adhering to this diet. And here we present, there were 2 patients that had, one of them had MGUS and one of them had smoldering myeloma. The blue lines on the left side here is their M spike trajectory, or the monoclonal protein trajectory. And you see how it's going up, sort of, and then it kind of plateaus after the intervention. So blue is pre-intervention, and then red is post-intervention. So it basically shows that we were able to slow down the disease trajectory, or basically reduce the risk of progression, or at least plateau the risk of progression to multiple myeloma. So Nutrition 1 was primarily at MSK in New York, but we do have Nutrition 3, which is a study looking at curcumin or other supplements. So omega-3 fatty acids, algae, curcumin. So supplements in combination or by itself with like a whole food plant-based diet or a high fiber plant-based diet. So all the 3 arms basically get the high fiber plant-based diet. And in one of the arms, it is coupled with nutrition counseling. In one of the arms, it's coupled with supplements. And another arm, it's coupled with a placebo. But you at least get the high fiber plant-based diet. And this study is open at Emory. And so if you have, we currently are prioritizing low-risk smoldering patients to this study, because we do recognize that dietary interventions can definitely alter your progression. But if you have high-risk smoldering myeloma, you probably need a little more than a dietary intervention, which would be chemotherapy or getting an active drug. And so we do have trials for high-risk and intermediate-risk smoldering myeloma as well, open at Emory. So please ask your doctors for information about that if you have been diagnosed with any of those conditions. And if you have low-risk smoldering or MGUS, and you are interested in this kind of a dietary intervention, which is a very low-risk intervention, but yet would have favorable impacts, not just on your myeloma risk, but overall, if it helps you lose weight and changes the amount of inflammatory cytokines in your body, it's going to impact your risk of developing diabetes or developing heart disease or developing arthritis. So it has effects not just on the myeloma risk, I would say, but also on your whole body as a whole. So the study is open at Emory, so do ask your providers if you are interested in this study. And so future directions, personally me and Dr. Shah have been looking at the influence of diet and the gut microbiome on outcomes with CAR T-cell therapy and bispecific antibodies, and to see if that basically can improve outcomes of these therapies by favorably altering your own immune system by eating healthy and living a better lifestyle. And amyloidosis is an associated disorder with multiple myeloma that sometimes exists, and we're looking at the microbiome and the effect of diet on the microbiome in amyloidosis as well. And there is reason to believe that the gut microbiome might be playing a role in development of drug resistance, and that's an area of active research as well. And so I just have 3 practical steps. No more than 1 teaspoon of salt in a day. Try and eat at least 2 cups of fruits in a day, and try and eat 3 cups of vegetables in a day. And with that, I would like to end and thank my fabulous team at Emory. Thank you, HealthTree, for inviting me to give the talk. Thank you to Dr. Shah's team for all our wonderful collaborations, and thank you all for showing up on a Saturday for this event. And I'm happy to take questions. I know we are right at time for lunch break, but I'm happy to take some questions. Yeah.
Okay, and I think we'll just do like maybe 4 questions max, and then we'll head to lunch. And then please write your questions down, because we have a whole faculty Q&A session at the end.
Okay. Can you put the practical tip slide back, please?
Yeah.
And then also, where can we find the study results that you mentioned?
So online, if you look at, like the dietary recommendations, the study is titled Diet and Microbiome Impact on Multiple Myeloma and Other Plasma Cells Disorders. And it's authored by me. So if you look up my name, like Richa, Parikh, and I think maybe my Emory profile probably links you to the study as well.